Hello, I'm Dr. Sandra Freyhofer, American College of Physicians Liaison to ACIP, the Advisory Committee on Immunization Practices. Welcome to Case Studies in Adult Immunization. Meet Melba and Wade. They just turned 65. Wade's never been sick a day in his life except for an occasional cold. Melba's overweight, has diabetes, and was recently diagnosed with asthma. She also has elevated liver tests from fatty liver disease. She was given a PPSV23 several years ago when her diabetes was diagnosed. Melba came down with shingles last year, even though both she and Wade received the live shingles vaccine at age 60. You reviewed their immunizations at a recent checkup and said they needed pneumococcal vaccination at 65, so here they are. They also need the new shingles shot. Your office had run out of it at their last visit. Okay, but first, it's December. Did they get their flu shot? Yes, at the pharmacy back in October. And here's a heads up. The flu footnote has a link to available flu vaccine formulations with age indications. In addition to the inactivated standard versions, choices for those 65 and older include the high-dose shot and the adjuvanted flu vaccine, brand name Fluad. Now, what they came in for: shingles and pneumococcal vaccination. Look at Figure 1, vaccines by age, last column, for those 65 and older. The rows for zoster vaccination on both figures have been redesigned along with the footnote. There are now 2 FDA-approved shingles vaccine: the older live virus vaccine, Zoster Vaccine Live, abbreviated ZVL, brand name Zostavax, and the newly approved recombinant zoster vaccine, RZV for short, brand name Shingrix. At its October 2017 meeting, ACIP voted to recommend 2 doses of the new recombinant vaccine 2 to 6 months apart for immunocompetent adults 50 and older, even if they've had shingles in the past, and even if they've already received the older live virus vaccine, ZVL. For adults 60 and older, either recombinant or live vaccine can be given, but the recombinant zoster vaccine, RZV, is preferred. So even though Melba and Wade already received a dose of the older live vaccine, they now need 2 doses of the new recombinant zoster vaccine. You administer the first dose today and schedule the second dose to be given in 2 to 6 months. Pneumococcal vaccination is next. Read the footnotes carefully and don't get discouraged. Pneumococcal is one of the most complicated vaccination recommendations on the schedule. Order of administration and timing between doses matter. The column for 65 and older is yellow for both PCV13 brand name Prevnar and PPSV23 brand name Pneumovax. Now go to the footnote. Wade's been very healthy. He's never had a medical indication to receive pneumococcal vaccination in the past, but he's now 65, and he needs conjugate PCV13 now and polysaccharide PPSV23 at least a year later. For Melba, it's different because she does have some chronic medical conditions: diabetes, asthma, and fatty liver disease. Go to Figure 2 and look under the disease-appropriate columns. Look for yellow bars and check the designated footnotes. For lung disease, which includes asthma, PPSV23 is indicated. Chronic liver disease now includes fatty liver disease. PPSV23, in addition to Hep A and B vaccination, are indicated. For diabetes, PPSV23 and Hep B are indicated. That's what she needs, but what has she had? Because of her chronic medical conditions, she had already received Hep A-B combination series. She'd already received a dose of PPSV23 2 years ago at age 63. Like Wade, she needs PCV13 now, but the interval between PPSV23 doses has to be at least 5 years, so she'll have to wait 3 years to satisfy the 5-year interval. For pneumococcal vaccination, both need PCV13 now. Wade needs PPSV23 in a year. Melba needs PPSV23 in 3 years, which is 5 years after her last PPSV23 dose.